Mackenzie Bender is the marketing manager for Spooky Nook Sports in Manheim, Pennsylvania. Mackenzie, thank you for joining me.
Of course. Thank you for having me.
Now, Spooky Nook Sports offers a variety of different types of summer camps and activities. Can you give us a sense of what a normal summer would look like for your organization?
Yeah, so a normal summer, we would have our general Nook Kids Camp, which is just a general day camp. It lasts the full day. Parents can drop off as early as 7 a.m. and pick up as late as 6 p.m., but the activities typically run 9 to 4. And they're doing things like arts and craft, arcade, clip and climb, a whole bunch of a myriad of different activities. And then we also have individual sports-specific camps. So throughout the summer, they can sign up for a 3-day, a 5-day, a half day, a full day, soccer, baseball, softball, volleyball, field hockey, basketball, etc. This summer, things are, we're trying to keep as many of those options as possible, but that's what a typical summer camp schedule looks like here at the Nook.
Describe your facility. Does it include indoor areas and outdoor areas? How big is it?
Yeah, so we are 14 acres under one roof. So just in our building itself, we have hardwood courts, sport courts, small turfs, an indoor baseball diamond, some batting cages, a fitness center, a sports performance area, so the athletes can do more training-specific camps there. And then we also have an outdoor field hockey pitch and an outdoor climate-controlled dome, which has that same size pitch, just located in a climate-controlled area outside of our building.
So when the coronavirus crisis hit us in March and we all had to stay at home and businesses shut down, how did that affect your business?
Drastically. We went from the week before the stay-at-home order, we went from 803 employees down to about 11. So we temporarily laid off, almost 800 people just to try to reserve cash so that we could bring them back as quickly as possible. At the beginning, no one knew, was this going to last 2 weeks? Was this going to last a month? And then when the federal government kind of said, hey, we're aiming for May 1st, right at the very beginning, it was kind of a reality check for all of us. Like, we need to reserve even more cash than we thought. So we kind of operated for most of that time on a skeleton crew of 8 or 9 employees. With summer camp starting up, we've ramped up to about 25, but that's still, 775 people unemployed just from our company itself.
And once you found out that summer camps would be allowed to be open during the yellow phase and certainly during the green phase, how did that affect your planning?
I mean, we were excited, but at the end of the day, summer camps is great. It's awesome to provide a great opportunity for those parents and families in our area to have something to do during the day, especially since they've been inside for so long and, not going to school and things like that. But at the end of the day, summer camps is just a very, very small piece of what we do. Summer camps is 200 kids a week, give or take. We're used to 56,000 people in the course of a 3-day weekend coming for tournaments and major events. So it's absolutely been a shift, and we're just kind of anxiously awaiting that next step.
Now, this is that time of year, of course, when parents are dropping their kids off for all these different summer camp activities. Are there any camps or any activities that you're not offering this summer because of the coronavirus?
Our general day camp normally does field trips. So they do one field trip a week and then one pool day a week to a community pool. We're not offering those this summer just because the summer camp guidelines that we're following, and then we then use those to create from the CDC and the PA Department of Health. We're a little restrictive in those areas, and understandably so. But so that's kind of the one piece we had to eliminate. But we really tried our best to keep all of our offerings the same in terms of, if you want a soccer camp, you're going to have a soccer camp to sign up for. If you just want the generic camp, you have the generic camp, everything in between. But some of the activities are just going to look a little different. So those minimizing field trips and pool time. We do have a climbing camp. They are still going on field trips because they're going to open air parks and things like that, as opposed to high trafficked areas like Hershey Park or the Renaissance Fair, things of that nature.
How did Spooky Nook arrive at its coronavirus related guidelines? Were there specific things that were provided by the state or federal governments, and how much of it did you develop on your own?
Yeah, so it's been really interesting. We're redefining every area of our business as its own area. So we are creating reopening guidelines for our fitness center, for our meetings and events, for our youth sports, for our summer camps. So for summer camps specifically, the CDC and the Pennsylvania Department of Health both put out guidelines and recommendations for summer camps. So we took both of those, mashed them together, and then added some of our own stuff on top of that in terms of waivers and things that are more specific to our facility. So our document ended up being a pretty extensive 8-page document, but when we sent it out to parents and families as, hey, we're doing everything we need to do and some more just to make sure you feel comfortable sending your kid to our camp and we're going to return them to you happy, healthy, and safe. The sense of relief was really, we got a lot of positive feedback in terms of, we're so glad to hear you're doing all of this. Some parents even saying, you didn't even need to, this is way above and beyond what we expected, but we appreciate the fact that you're trying to make us feel as comfortable as possible.
So if a parent is coming in the morning to drop off their child for a day at the camp, what can they expect? What types of coronavirus related testing or procedures can they expect?
Yeah, so you'll notice our protocols as soon as you pull into the parking lot. There will be signs and cones directing you around a certain way. You'll actually pull up to like a welcome tent area where we will have staff out there with masks and gloves and clipboards, and the parent actually stays in the car. The kid gets out, we do a touchless thermometer temperature check while another staff member asks the parent questions through an open car window. Is anyone in the household sick? Things like that, things that have been provided by the CDC as recommended questions. And then once the temperature clears and the questions clear, we collect any necessary paperwork if they have, medical forms or anything like that we need to collect. And then we have an escort that walks the kid into the building, and then another escort inside. That's kind of the in-house escort. So we try to keep one staff outside, one staff inside, and then they walk them back to the camp. The biggest difference is we're being a little more strict this year on our 10-to-1 camper to staff ratio. So kids will really be grouped into their own little mini camps all week long, and there won't be a whole lot of crossover between those groups of 10.
Now, there are many things that we've all become accustomed to, wearing masks and social distancing. How do those apply to your summer camps?
Yeah, so we're encouraging social distancing whenever feasible. Obviously, for some of the sports, that's a little bit harder, but we're really doing our best to find drills and activities and that kind of keep kids as separate as we can. Our staff are all masked, so masks and face shields for our staff per whatever is most comfortable for them, depending on if they're doing a sport or not. The campers do not have to wear masks. So it continues to be a recommendation if they feel comfortable wearing it. If the parent wants them to wear it, great, they are more than welcome to. But what we don't want is, a kid running around for 30 minutes in a mask trying to breathe, and then that creates a whole nother issue in and of itself. So we're trying to let it up to the discretion of the parents and the families, whatever they feel comfortable with, but our staff will be masked.
Now, to talk about your staff, are you able to bring back more of your staff as the summer camps are starting to ramp up?
So we brought back all of our sports directors. So they are in charge of their own sports programming here, and they will be running most of the camps themselves. As their camps grow, they will get to bring back, one staff person per 10 kids signed up for that week of camp. So it's a step in the right direction. We're happy to have as many people back as we can, but in the grand scheme of things, it's still a very small number in terms of our total employment.
Now, did your employees go through special training before you started to open up again?
We brought our staff back about a week before we opened summer camps, which is crazy to think about because we had about 2 weeks of the guidelines being public, 1 week of training and figuring it out, and then camp started. But we brought all of our staff back last week, did a full extensive training. We had to sign off on here's how to use this chemical, here's how to use this cleaning product, paperwork. So they've all been trained in the new cleaning schedules, the new social distancing procedures. We wanted to make sure they could do what they were doing in masks, so we did a little bit of that training. And so they went through about 3 full days of training before camps launched yesterday.
So you talked earlier about some of the things that parents can expect when they drop off their kids. If somebody's temperature is outside the acceptable standard, or if there's something else that is a red flag, how do you react to that?
Yeah, so that was definitely a tricky one this summer. What we said in our guidelines and when we made registration for summer camps open is we made it very clear to parents, safety and health of our customers is our number one concern. So if your child shows up and is running a fever, they're not going to be let into camp that day. And until they're non-symptomatic for 72 hours, they're not going to be let back in. So we are actually offering something we've never done before, and we're calling it a safeguard. So basically, for $25 per week, you can buy a policy that allows you to, hey, if your kid shows up on Tuesday and they have a temperature and we can't let them into the building, we'll refund you your money as long as you've purchased this safeguard. We're not trying to cheat anyone out of it. We also have to protect the kids that are in the building and that are healthy from someone who might show up with some of those symptoms or a fever.
Now, as Pennsylvania and the country begins to open up over the next few months, there is concern that we could see a resurgence of coronavirus cases. Are you prepared for that? Are you keeping an eye on that?
We're absolutely keeping an eye on it. Our team up in the office, we joke about how many days we spend watching the news and reading articles because we're genuinely just trying to make sure we're being considerate of anything that might come up. So we want to really make sure we're watching those numbers, really make sure we're adjusting our protocol and our guidelines to reflect what's happening in the community. So we have a meeting scheduled every Saturday at 9 a.m. after each week of camp to say, how did everything go this week? Are our procedures still right? Is our protocol still right? Do we need to change things? Do we need to tweak things? And then communicating those changes out to the community as we come up with them.
We've been speaking with Mackenzie Bender. She is the marketing manager at Spooky Nook Sports in Manheim, Pennsylvania. Thank you for speaking with me.
Thank you again for having me.
During the uncertain times brought on by the coronavirus outbreak, PCN remains committed to the needs of Pennsylvania and its people. PCN provides free daily coronavirus updates from Governor Wolf and the Department of Health Secretary Dr. Levine, live, on air, and streaming on the app and online. These updates will be available to watch in their entirety on demand for free by downloading the PCN app or at pcntv.com. PCN, committed to keeping Pennsylvania informed.
We're joined by Sally Nolt, president of the Pennsylvania State Association of County Fairs. Thank you for being here.
Thank you.
Now, county fairs are just kind of a normal part of our warmer months here in Pennsylvania. They happen all over the state. Can you give us a sense of how many county fairs we would usually expect to see?
There are currently 108 agricultural county fairs.
And how many at this point do you know that have canceled?
As of last night, we have 51 that are canceled and 4 that are going to be modified and will not be considered actual fairs.
Now, certainly we have a few more months left in the warmer months for the hold fairs. Are some fair organizations able to move their fairs later in the summer?
Pretty much the dates that are set cannot really be changed. Some of the fairs are waiting as long as they can to see if the guidelines change, if they're able to operate. We expect quite a few more to follow suit.
Now, we are going through the reopening phase with most counties going into being in the yellow and others moving into the green. How do the restrictions in each of those different phases affect whether people can hold a county fair?
Well, it's really almost impossible for most fairs to contact a fair with only 250 people, particularly if you count in the fair personnel, exhibitors, concessionaires. That doesn't leave many to come from the public. That makes it very, very difficult.
Now, are there any fairs that are moving forward? You mentioned some are doing smaller operations. What types of steps are they taking?
What they're doing is they're trying to have shows for the kids with their animals, possibly sales. Some of them are going to have some food trucks, but they will not qualify as fairs.
Now, you mentioned the kids with the animals, and that's something that maybe we don't think about, especially the economic side of that. Many of these children, they'll spend a long time preparing their animals to show, and then after the competition, they can often sell them and make money off of that. How will not holding these fairs affect them?
Oh, it will hurt them drastically. Many of them take that money and put it into college funds or buy more animals. Also, our local businesses and our local civic organizations, hurt the same way. A lot of our civic organizations, it's their main fundraiser of the year, and that money goes back into the community. So it's difficult.
Now, over the past few months, what kind of state guidance has been provided to fair organizations?
Almost none, other than the guidelines that we read or hear on TV. I've had several meetings with legislators and the Secretary of Ag, and all they're really saying is the decisions are up to us, and we know what the guidelines are. And the sanitizing regulations make it very difficult too for fairs.
Now, talk about some of the different limitations, because as fair organizations are making their decisions on whether to move forward or to cancel, certainly they're taking into consideration things like the number of people that they're allowed to have. Can we talk about some of those different elements and how fair organizations are making those decisions?
Okay, the number of people, of course, as I already mentioned, makes it very, very difficult to hold a fair. The sanitizing, looking after tables, benches, etc., it makes it very difficult and expensive. A lot of the carnivals are not going to be able to run, so that's income for fairs. That's a consideration. Health also. I mean, a lot of fair volunteers are elderly and have health conditions, so that puts them at risk. That was one of the concerns. So there's a lot people don't realize that goes into planning.
Can you talk a little bit about the different ways that fairs make money?
How do we make money? Well, a lot of, speaking from my own fair, is sponsorships, community support. Of course, our concessionaires pay to be there. Fairs that have a carnival get a cut from the proceeds of the carnival. My fair does not have parking or a gate. Fairs that have parking and gates have income that way. Often it's fire companies or other organizations that do the parking, and they're community groups that are benefited also.
Are there any kind of minimum number of people that you would need to have come in, or a minimum number of vendors showing up to be profitable?
Well, most fairs have a budget, and it's itemized out how much they need to make from concessions, how much they need to make from rides, et cetera, and it's different for every fair. And a lot of fairs have already expended money for advertising for their premium books, and that's just lost at this point.
Now, you mentioned your fair. What fair are you involved in, and what's that? The Elizabethtown Fair. What's the planning process like? How many months in advance do you start planning and preparing for the fair?
We start planning next year before this year begins. We meet monthly, year-round. Committees meet regularly. It's ongoing.
Now, has your organization made a decision about whether to go forward with this year's fair?
Yes, we are canceled. We don't have a gate, so we have no way to control the crowds. So there's no way we could begin to limit the number of people coming.
Now, how do you, as the president of the statewide organization, how do you estimate the ripple effect in communities of shutting down a fair?
Oh, it will be unreal. Like I said, civic organizations, Kiwanis clubs, Lions clubs, our Grange, it's their major fund maker, and that's money that goes back into the community that's going to be lost. Churches have stands, and that's one of their major fundraisers. The church adjacent to our fairgrounds does our parking, and that money that they make all goes into different charities that they support, and that won't be available to them either.
Now, you mentioned that you've been in conversations with state legislators. What type of response did you get from them?
Well, they're all very, very supportive of us, and they understand that we're in a tough spot, but they're really not saying how we can operate, because with the guidelines, it's really almost impossible. I know there are fairs that are planning to go ahead, in spite of it.
Now, is there any legislation that your organization would like to see implemented that could help out fair organizations?
Presently, there is some legislation being proposed to help us with funding. There's a Fair Fund Act that dictates how we get funding, and if you don't operate, you don't get any funding. And there is legislation being proposed to at least for 1 year, cut that out, so we would get funds based on the previous fair. but that hasn't made any movement at this point.
Now, if the opening process proceeds in, say, mid-July, would things open up and those restrictions on the number of people that can come in are lifted, would fair organizations have enough time to start up a fair that they had previously canceled?
No, that it really wouldn't be possible. The advertising, and we as of now, we would have lost all of our exhibitors. I mean, for my fair, we have around 150 concessionaires. We couldn't recoup them in a short notice.
Well, Sally Nolt, president of the Pennsylvania State Association of County Fairs, thank you for speaking with me.
And thank you for having me.
I'm Dave Williams, your host here on Pennsylvania Country Roads. This week we're going to travel to Newville, Pennsylvania. Chestnut Farms. Todd Chestnut, a diversified farmer with hogs, cattle, and organic chickens. Then we're going to talk to Tori Forrester, New Holland dealer in Chambersburg, Pennsylvania, and he plays a major role in the Pennsylvania Farm Show. All this and much more this Sunday on 7 a.m. on PCN TV.
Dr. James Tauberg is the president of the Pennsylvania Dental Association. Thank you for being here.
It's my pleasure.
Now, a few months ago, as the COVID-19 crisis appeared and the economy began to shut down, how did that affect dental practices?
We began to learn of COVID probably at the beginning part of 2020. It was around the 17th of March 2020 that it began to impact dentists. And by Sunday, the 22nd, the Department of Health came out with an order basically having us shut down unless we were able to provide our care under what are called negative pressure rooms, which occur only in hospital settings for the most part and are few and far in between, basically shutting dentistry down effectively. There was a great cry as to how else could we provide for at least emergency care. We didn't want all our emergency patients to overwhelm what were then overwhelmed emergency rooms at the hospital. So through quite a few voices by that Friday, the 27th of March, that edict had been changed, where now we had a certain degree of special screenings for patients, all kinds of special infection control, disinfection, social distancing methods in place. And we were then allowed to see what were called urgent and emergent patients only. It went like that pretty much until May the 8th. May the 8th, the Department of Health changed it slightly, and now we were able to see more patients, but still we had to evaluate everybody based on incidence of COVID. We had to, of course, again, try to delay care if we could, and only, again, try to take care of things that really had to be done immediately. That all basically changed on June the 3rd, where the Department of Health pretty much opened up dentistry. And again, we follow all the appropriate CDC, OSHA guidelines, Department of Health guidelines. We follow the American Dental Association and Pennsylvania Dental Association toolkits. And we provide proper PPE, proper disinfection, proper social distancing, everything you could imagine, extra safe, more than it ever was before in a dental office. And we were always very safe, at least since the mid-'80s, back when the HIV epidemic occurred. And at this point, we're all pretty much getting back to practice or are back in practice.
Now, many of the rules that people have to follow are common in different places, a number of people who can be together, social distancing, masks. But dentists are unique in this particular regard because they're operating in people's mouths. And given the nature of this virus, that's a very different situation than the rest of us are dealing with in our workplaces. What are some of the special concerns that dentists have? So
obviously, dentistry is an area where the COVID, being a respiratory virus, a airborne virus, is of great concern. In dentistry, since again about the mid-'80s, when, as I mentioned before, the HIV epidemic occurred, we changed all our protocols. So in dental offices, you'll see your dentist always wearing a mask, gloves, safety eyewear. We would disinfect. We would be checking sterilization all the time. And up until the pandemic with COVID-19, there was really almost no disease transmission from a dental office. With this particular virus being so unique and so different, the CDC and the Department of Health asked that we to go to the next level. So now, if you go to the dentist, you'll see even more strict guidelines. Many times you will be screened when you make your appointment. You'll be screened again before you come into the office. Some offices are allowing only the patient themselves to come through. They are screened by temperature. They're given usually a mask. They're asked to sanitize their hands or brought back to the dental room itself. We then, of course, now wear KN or N95 masks, which are special respiratory type masks, along with sometimes a surgical mask covering that. We now wear face shields, full gowns, and again, sometimes we're wearing different types of head coverings, shoe coverings. That's just to start. Plus, all kinds of disinfection within the office, sometimes different types of air engineering, filtration in the office, everything to make the office now even safer than it ever was before. In fact, I'll go as far to say that it might be one of the safer places to be right now.
Now, the issue of access to personal protective equipment has popped up in a variety of different places around the state. What kind of access have dentists had for PPE?
So we have had very bad access. That's a nice way of saying it. Unfortunately, in Pennsylvania, even though the American Dental Association has worked with FEMA on the national level to get dentistry listed as the number 4 most needy group for personal protection equipment, PPE, followed by, in Pennsylvania, the Department of Health and the corresponding group, which is called PEMA, we are not on their list due to Pennsylvania having trouble still getting adequate supplies of PPE for the first 3 groups, which are basically nursing homes, healthcare responders, and first-line responders.
Now, are dentists on their own trying to acquire this equipment, or are they able to work through, say, an organization like yours, the PA Dental Association, to acquire it in bulk?
Even through the Dental Association, there are problems getting PPE. So we were told pretty much to go through the business to business by the Department of Health and PEMA in Pennsylvania, or to source it on our own. Sometimes you can get large bulk. Trouble is its distribution. So once you get large bulk, where does it go? And how does that group then have to pay or organize for distribution to 10,000 plus dentists in Pennsylvania? So it becomes a real supply chain and then a difficult distribution problem here in Pennsylvania. However, we can get it. Prices are skyrocketing, and now with other businesses opening, it's becoming even more difficult to get PPE. And when you do get it, you pay a premium price for it.
Now, you've mentioned discussions ongoing with the Department of Health. How has that relationship been working throughout this time period?
I think the relationship's been certainly very good. We certainly respect what happens and how difficult it must be at the state level to take care of so many different issues with a pandemic like COVID-19. And we've had, I would say, weekly to every 10-day discussions with the Department of Health. And that's how we've slowly maneuvered since March through June 3rd to get ourselves back open again. So all in all, a good relationship, and one that should continue because we're part of the healthcare field, as oral healthcare is an important part to general overhaul health.
Have you been able to have your concerns addressed or included in the guidance that the Department of Health is providing?
I would say as best as absolutely possible, sure.
Are there any policies at the legislative level that you would like to see implemented that may make this better in the future?
If I had anything at all at this point, I would probably say it'd be nice to try to get PPE on some other type of level to keep the cost down, not just for us, but obviously to the public that we serve. The higher the costs, sooner or later it becomes a mathematical issue. How can we provide care? How can we participate in third-party programs to provide good care at a good price, and then find that we have to buy equipment that makes it so costly you can't even afford to do the procedures.
Now, state and federal aid packages have gone through different legislatures. Are dental practices eligible for money from these different sources?
EIDL loans and PPP loans, yes. And even to some degree, if you're in private practice, there are unemployment loans. There are other private grants available. So of course it takes time and effort to get those. And then of course you have to follow all the guidelines for repayment unless it was an actual grant. But yes, we can get that.
Now, how have patients been able to use something like teledentistry to work in this era?
So teledentistry is something brand new, and for us at least in Pennsylvania, it does provide a way to actually see the patient and talk to the patient and try to get an idea of what their problem is. Of course, all you can do, as we're doing right now, is you can look at somebody, you can inspect them. But in dentistry, you need to be able to palpate the tooth or palpate the mouth. That means to touch. It means you have to be able to probe an area to determine is there decay or a gum problem, and be able to look further down the mouth than you could actually do, as we're doing right now, in a type of teledentistry type of environment. So it's a good screening tool, but it has no place to be better than an exam. An exam is still what's absolutely necessary.
So we're just at the beginning of this reopening phase. What are some of the things that dentists are looking for over the next few months to see whether these practices are working?
I actually just got off an American Dental Association webinar, and the webinar says that practices are opening. The biggest issue now is that based on how we disinfect and how we socially distance, we can't see the same volume of patients that you used to see. So where you could see maybe a patient an hour, now you have to allow time for disinfection, not just for disinfection, but for the social distancing time. And as a result, less patients in a given day can be seen. So volume is down, and now you have to make it up from the 3 months that we were almost all shut down.
Dr. James Tauberg, President of the Pennsylvania Dental Association, thank you for speaking with me.
It is my pleasure.